Good afternoon, everybody. This is Erin with the Department of Medicaid. It's not quite 1 o'clock and we're still clearing out the waiting room, so we'll give it just a few minutes before we get started.
Sounds good.
Shut that door.
How you doing, Gary?
Doing well. How are you all?
Doing good.
Gary looks pretty kicked back and comfortable.
I
He
am.
does.
Yeah, I've done got my weekend.
I'm done. Okay.
Remember, if you're going to snore, mute your microphone.
I got you. It could definitely happen with these new grandbabies. New grandbaby and an older grandbaby. I don't get much sleep. They're in the house with us right now, living. So
Yeah,
it's a
that
little
can be
different.
hectic.
A little different.
Matt, aren't we one member short? Didn't Carolyn resign?
I have not heard from her that she has.
Okay. Maybe I don't know. Maybe I heard that from Alex or.
No, I heard the same thing, Steve. But I don't know where.
I have not heard that, if it helps.
I don't know.
Now, that doesn't mean it hasn't happened, but no one has reached out to me with a replacement or that information.
I know she told me that she wouldn't be able to be on the call today, but she didn't mention anything about.
Well, if she was still, okay, it sounds like she has not resigned then.
Right.
She's got a lot going on.
Yeah.
Right.
It is sorry about that. It is 1 o'clock and the waiting room is clear. I show 3 of the 5, so you do have a quorum.
Well, I guess we're ready to go then. You guys ready?
Sure.
Okay. Well, once again, I'm Dr. Matt Burchett, chair of the TAC. Thank you all for being here. I know we haven't met in a little while. Hadn't really been a great many issues, I don't think, come up in the last little bit, but we do have a few things to talk about today. So we'll go ahead and get started. First order of business, as always, is approval of the minutes from the last meeting. You all have looked at them. I'll entertain a motion for approval.
I'll make a motion to be approved.
I'll second.
Sounds good. All in favor?
Aye.
Good, good. So that passes. So we'll jump right in and start this down the list. Next thing is old business. Basically, we're just checking in with DMS to see if there's any update on how the process is going. And the secondary question is, do optometrists still need to upload their licenses now that you're communicating with the Board of Examiners?
Dinsky with Program Integrity. The process seems to be working great now, so there should be no need for a provider to go in and upload the license into our partner portal as long as they have everything squared away with the board. So we've been moving along for quite some time now with that working successfully, so I think we're in good shape. I would encourage, though, for providers just to go in and maybe check the file, just to make sure, just for safety's sake, but I believe everything's working great.
Sounds good. Any questions, guys?
No, sounds good.
Okay. Yeah. I know that's been a long time coming and a lot of people have been working on it. So I'm glad to hear that things are moving along good there.
We are too.
Yes, I'm sure. I'm sure. So, jumping on down, new business. As I guess most of you all on the TAC know, we've had some issues with the Visas's portal over the last 3 weeks or so. And I'd just like to hear from Avisus on how that's going and how they're managing all that.
Hi, Dr. Burchett. This is Kim Gray from Avisus.
Mm-hmm.
So I am pleased to report today that we have some solutioning in place that we will be developing a communication on and sharing with the TAC and the rest of the vision provider community. One of the issues that I know the providers were experiencing was the issue with the lab link. And we do have an external lab link that is available for providers to utilize and submit material orders through. We are in the process of developing that communication and outlining that process. We will be issuing usernames and passwords or assisting you with establishing those usernames and passwords for the lab link. And you will be able to place the orders for the materials in the next day or two. We also have put in a fix for the issues that were being experienced with the eligibility and benefit accumulators. So those are available on the portal now. We've done extensive testing, and you should now be able to obtain that eligibility and benefit information as you have in the past.
Okay, so that part's ready now.
That part is ready now, correct?
Okay.
Yep. And I think those were the two largest issues that you may have been experiencing, but if there's anything else, let me know.
I know some providers had talked a lot about the timing out on them and then receiving a lot of error messages.
Yeah,
And
that
I
has been
assume,
fixed as well.
okay.
Yep, we tested that yesterday and there are no issues, no more issues with the timeout, the portal timing out and the error messages that were popping up.
And you said the information will be sent out how soon again?
So our provider relations manager for Vision is drafting that provider communication piece today. I would say within the next day or two, that information should be going out to all providers on how to set up their account for that lab link.
Okay. Yeah, I know it's been 3 going on 4 weeks now, and that's a lot of time for people to wait on glasses.
Yes, I am hearing that the lab, so I know most of you are using Correct Optical. They have a really quick turnaround time. So we've been in communication with them and that turnaround time should remain intact. So those materials should go out quickly as soon as they receive the orders. Greatly appreciate everyone's patience as we work through some of these issues and appreciate you bringing them to our attention.
Any questions from anybody?
You might want to
Yeah.
clarify, we were having some issues on the Avisus WellCare, actually it was Medicaid Advantage or Medicare Advantage, being able to find the dollar amount of what they had to use. And Miranda told me how to do that yesterday. You might want to just make sure everybody understands how to do that.
Okay, I think Miranda, are you on the call today?
Hi, I am here. I will add that to the communication that is going out, just to clarify that for providers.
All right.
Any other questions? If not, let's move on then.
Thank you.
No, thank you all for the update. Appreciate
Sure
it.
thing.
Next, I'll let Steve take over on this one. I think this is something that's come up for you.
It is, and I've got Cindy in here with me, so I may have to lean on her to get the explanation. It's not about building glasses, it's about building an exam, right?
Yes, exactly.
Yes. Patient had a Medicare savings plan
With ADS, yes.
with ADS.
She had Medicare primary,
Medicare is primary,
ADS second.
ADS secondary. We found out it's a Medicare savings plan. Patient had a routine diagnosis, so Medicare denied it. Filled out, I don't know, you have to fill out a form or something before that to DMS. Did all of that, and they denied it with what kind of code?
Well, it just says it's covered by somebody
Says
else.
covered by somebody else, which is Medicare. So we called, talked to Danielle, who politely informed us that we just have to eat the exam and not get paid. So I'm not totally against charity, but I don't think this ought to be a charity case. Somebody should be paying that exam claim. If they'd had a medical diagnosis, Medicare would have paid it, but this was a fairly young patient. I don't know why they had Medicare.
Hi, Dr. Compton.
Yes,
This is Kelly Kitchen. So talking about billing for codes for members that have Medicare primary, it sounds like that member had QMB, correct? So because of
correct.
Medicare savings plan. So when a member is in QMB, the only time that Medicaid ever pays for service is if Medicare pays. So in the case if it is a code that Medicare does not pay and the member is in QMB, Medicaid isn't going to pay because Medicaid only pays the coinsurance and deductible. And if Medicare doesn't pay, there is no coinsurance and deductible to pay. So only dual covered members would be covered for anything eyeglasses.
This is for the exam.
Even the exam for any service. That's
So-
any service. So if Medicare, if they're QMB and they have Medicare, QMB with Medicaid, if Medicare doesn't pay it, then there's nothing for Medicaid to pay because
So who
Medicaid
pays?
only pays coinsurance and deductible. So if Medicare doesn't pay, there is no coinsurance or
I
deductible.
understand all that,
Mhm.
but who does pay me? Patient? I bill the patient?
If they have Medicare with QMB, you would have to do the ABN form per Medicare, per federal government.
Or just not see them?
I can't
So-
make that recommendation.
Right, something's not.
Yeah,
I just
Dr. Compton, this is Justin Derringer with DMS as well. Thank you, Kelly. I think she explained it correctly. Medicaid services where individuals only qualify for QMB, we only pay that coinsurance and copayment. That's it. So we don't pay for any services. So only if Medicare covers a claim, whatever copayment they may have is what we cover. That's how that QMB works. So if they fall in that QMB eligibility range, and that's all we can do for Medicaid. So we can't speak to anything beyond that, like what Medicare may or may not do. So I'll leave that to
If it's a young patient with a routine diagnosis, they're just out of luck, or I'm out of luck.
They usually don't have Medicare.
I heard somebody.
That-
It's an unusual
that-
situation.
Yeah, no, that's not entirely true. I've got a lot of young people in McKee who are disabled that have that same situation.
Mhm.
Medicare with the Medicaid stuff.
And there's two different types. So just, and then I'm not an eligibility specialist, but just to kind of understand the difference, you'll have individuals that have dual, so they'll have Medicare and
Mhm.
Medicaid. In that case, we would pay everything Medicare doesn't pay. Um, However, QMB is a different eligibility group. So there are different parameters as far as eligibility is concerned. And again, I'm not an eligibility expert, but they, as you all know, they look at income, they look at assets, all those different things when determining somebody's eligibility for Medicaid. And so if that puts them into a different group, then they would be put into that QMB group because they have higher income or higher assets or whatever the case may be. And so that's the group they fall into at that point, which means that we only cover that copay for Medicare. And that's that QMB, I think it's program code Z, those individuals.
That's correct. So nobody's gonna pay is what it amounts to. Provider's stuck or the patient's stuck. That's what I'm hearing.
So Justin, if the patient changed the type of coverage they have with Medicare, got a more extensive plan, would that, if they got a plan that covered vision and glasses, would that cover them, or are they unable to get a plan like that? Or is it all individual?
It's all individual, so I'm not sure. I wouldn't be able to speak to. I'm not a Medicare expert either necessarily. So, and I know there are a lot of different plans out there for Medicare. There's a lot of individuals that reach out to people and put them in different plans and sell them on different plans for Medicare. So that's maybe an issue as well. The individual has a choice for Medicare to be able to enroll in different plans. Where Medicaid, we have one plan, right? If you have Medicaid, you have Medicaid, and then we just have a choice of providers, but we have the same base services. Our fee for service Medicaid sets a base services. So when you all look at your optometric fee schedule, those things are going to be covered. You don't necessarily know the exact price, but exactly what's going to be covered, the limitations on that, and so on. Medicare is different. You have a lot of different plans that you can choose for Medicare, and they cover different things at different rates and different ways. So that would be something that would be individual to that, or be specific to that individual based on their Medicare plan, and that would be something that the provider would have to work out with Medicare on that federal level. There's nothing we can do as
Medicare does not cover routine diagnosis.
Medicaid does not cover anything for an individual that has QMB Medicaid.
I understand you. I understand that. I'm just saying it's a quandary. Medicare doesn't cover it. You're not going to cover it. Sounds like we have to get an ABN from the patient, collect from them. And then they'll have to fight it out. So I think I've gotten my answer. It's not what I wanted, but I got it.
Well, that means on any of those patients, you're going to have to get the ABN up front, because you don't know, but when you go in with the exam room, whether it's going to be routine or medical.
Exactly. And if they're the typical Medicare age, they probably have something medical.
Right.
The young disabled folks got pretty healthy eyes as a rule.
Mm-hmm.
Yeah, I wish there was something more we could do with Medicaid. However, that's a strict federal requirement from CMS. We don't have any control over that.
All right, thank you. We'll just have to be more careful on all the QMBs.
Steve, I guess the next one's yours too.
It is. I went to a billing and coding seminar a week or two ago, and as you and Gary are both aware, there's a lot of emphasis now on myopia control. That typically would be billed medically necessary contact lenses as a rule, but there'd be several office visits in a year's time I had a printout on what you would typically bill, and I'll find that and forward it to Donna and Sarah, and they can spread it out to who all needs to see it. Just don't know if Medicaid or DMS is or any of the subcontractors are going to cover the fees for myopia control. And Gary, you may know more about how that's billed than I do. I'm just now exploring
I don't know the ins and outs of the billing. I know that it has become an epidemic with all of the devices that these young people have and or stay on all the time.
I'm trying to find it here. Maybe I'll find it before the meeting's over. But it'll be several 99,000 codes in a year's time.
Yeah, and if we can only use the diagnosis of myopia, then unless there's a different diagnostic code that I don't know about, unless we can use the degenerative myopia or something along that line, then the MCOs are not going to pay probable.
Exactly.
Mm-hmm.
So then that, that's over half the children in the state covered by Medicaid. They miss out on that kind of care.
If you want to send me any issues you might have with billing on that, we can take a look at it and do some
Yeah,
research.
I'll get that out. It's all new, so I thought I'd throw it
Sure.
out there and see what.
Yeah, we'd be happy to
That
take a
was-
look at that and see what we can do and what research we can pull.
I've got it here somewhere. Anyway, I should have had it ready already before the meeting.
Yeah, I'd be happy to look at it.
Okay, so if you see me on my phone here, I'm looking for it. I'm not on Facebook or.
Oh, well, I'm going to go ahead and move on then, Steve. We'll come back if
Okay.
you find it.
Yeah, we'll circle back if we need to.
Okay. Next, we've got a general discussion, and I've actually got two other points to add in there that have come to light since we put the agenda together. The first is a question about Anthem and Anthem not being involved in the MCO group after January 1st. If I'm not mistaken, they sent out a FAQ on things going on with that, with billing claims and reimbursements and things like that past that date. But we don't deal with Anthem. We deal with iQuest. And I was just curious to see if how iQuest is going to handle things from providers after January 1st.
iQuest is a subcontractor of Anthem, so Anthem is ultimately responsible. So they would,
Right.
they would,
Right.
the process that you receive from the FAQs and the letter would be relative to them as well. They will have to pay out claims and.
Okay, but right. I just wanted to make sure because we have billing issues that we were dealing with after January 1st. I know that applied to Anthem, but we don't deal with Anthem. We deal directly with iQuest. So I just wanted to make sure that was still.
Yes, sir.
Okay. Yeah. That was still good. Okay.
Dr. Burkett, yeah, you shouldn't have any issues with iQuest on the go forward. You're going to get some closer to the first of the year. You'll get some notices about it, but as long as it really comes down to whatever Kentucky Medicaid allows for as far as timeliness of claim submittal and things like that. Basically we're assuming there's going to be I don't know how long it is in Kentucky. I'm sorry if it's 180 days or 365, whatever it is for claims. We'll be processing those all the way through, including, reconsiderations and all the other stuff you wouldn't necessarily want to have access to, appeals, things like that.
Sure. And I assume that was what was going to be the case, but I've learned in 50 years never to assume anything. So
yeah, no problem.
We'd ask. And then the other thing is, this is the last TAC meeting of the year. We'll get together on some dates for next year here in the next little bit and get those out. But the question I had is, are any of the MCOs planning on changing anything for next year, adding other services or things that they might have not covered in the past or anything like that? Well, and hearing nothing, that's okay. But if things do change, we would appreciate giving the TAC and the KOA a heads up on those changes so we can communicate that with our membership as well.
Matt, if
So,
I may,
yes.
I
Yeah.
do actually have the meeting dates for next year. I go in order as they come, and your alls was next in line.
No, you're
So
fine.
I have February 6th, May 1st, August 7th, and November 6th. And if those work, I can put that in writing and then get you guys the official calendar invites, everything. So I just want to let you know I do have those in the works. I just hadn't gotten them out to you yet.
No, it wasn't a big deal. I just didn't have them. So,
I try to have them out by the end of October for everybody, but November snuck up on me this year.
no, you're fine. Without looking at the calendar, I think those dates work for me. But is it okay if, we let everybody look at their calendars and then get back to you on those dates?
Absolutely. Like I said, I'll follow up in writing with those dates tomorrow.
Sounds good. Appreciate it. Steve, anything?
I haven't found it yet, although I did run across, supposedly there's gonna be a new code for OCTA next year. We'll need to get that added. I can't remember how you do it. You get regulations or what?
Well, the Board of Examiners has to add it to our list of approved codes first, I think. But and I'm sure they have it. I'll check and make sure.
Yeah.
And then that looks like all I have. I was going to recognize the executive director of the KOA, Dinah Bevington. She has a couple comments to make on the upcoming driver's vision changes. Dinah, are you on here?
I am. Can you hear me?
I can.
All right. Hi, everybody. As Dr. Burchett said, my name's Dinah Bevington. I am the Executive Director of the Optometric Association here, and we wanted to make sure that this group, specifically the MCOs and DMS, obviously, were updated on some new requirements that the Kentucky legislature put into effect that will be effective January 1st of 2025. Starting that date, all drivers in Kentucky at the time of their license renewal will have to get a license, basically proof that they meet the minimal visual standards in Kentucky. That does not exist now. Currently in Kentucky, you only have to have a vision exam or otherwise show that you meet those standards at the time of initial licensures, which is typically at 16. And then never again in Kentucky do you have your vision tested for purposes of driver's licensing. This law was passed in 2021. And again, it's going to be effective in 2025, January 1st, 25. And in light of the large population that is covered by Medicaid, we definitely wanted to make sure that this was on your radars. And I just wanted to kind of highlight the way the process will work from a 30,000 foot level. But I am also, while I'm doing this, going to put in the chat a link to what the Transportation Cabinet has produced and put on their public website for individuals to follow up on and get more information. So I encourage you to take a look at that website as well. But just from a big picture standpoint, the way this will work, individuals will go to their regional licensing site in Kentucky. So there is not a licensing site in each county, which is, you might have heard about a little bit of some of the frustrations there. So we anticipate, there might be some additional frustrations with this, but they go to their regional licensing site. They can either at that time look into a visual field device to show that they also can see the acuity and the visual field and meet those standards. And if they do, then they're cleared to renew their license. If they do not pass those minimum standards, they are then referred to an optometrist or an ophthalmologist for a complete vision exam. So that is what currently happens with the initial licensure. That's what happens with 16-year-olds. That is the exact same process that will happen again for all drivers of all ages. In lieu of that, drivers can bring at the time of license renewal, they can bring a form that has been completed by a medical specialist, whether an optometrist, an ophthalmologist, an APRN, or a DO. Once they're accredited by the transportation cabinet, they can fill out that form, which has to be completed within the prior 12 months, stating that the individual meets those requirements. So trying to make it as least burdensome as possible on the driver. They can show up again with the form that's been signed within the prior 12 months, saying that they meet the requirements, or they can use that equipment on site for free. But again, we do anticipate that there will be some additional referrals for vision exams. And so wanted to make sure that that was certainly on your radar. And I'm happy to answer any questions. Right now, we do not have the form. It's not been finalized by the Transportation Cabinet. Transportation Cabinet now in Kentucky is solely responsible for driver's licensing. Previously, it was split between circuit clerks and KSP and a couple other folks. So we're waiting on the Transportation Cabinet to give us that final form, because we also want to obviously let our members have that so that they are ready. But as soon as that's ready, hopefully that'll be posted and shared. We will definitely share with DMS if the cabinet hasn't already done that, or at least started that communication with you, because we want to make sure that this is as seamless as possible across all different lines. So I'm happy to answer any questions. If I've totally confused you, I apologize. But again, take a look at that link. And the cabinet is working. I think they're going to be putting out a lot of different press releases and some campaign materials. Our doctors will be equipped with that as well. But definitely wanted the MCOs to have that at their disposal as well for any questions that you'll get. So again, I'm happy to answer any questions, but just wanted to make sure that you were aware of this upcoming change.
Thank you, Donna.
Thanks.
Well, gentlemen, do you have any other things to discuss? Or are we good for now?
I'll find that myopia management billing, I don't know what to call it, protocol, I guess, and get to the KOA office.
Sounds good. We'll go from there on that one, Steve.
All right.
Well, with no other business, I guess I'll take a motion to adjourn.
So move.
Second.
All in favor?
Aye.
Thank you, gentlemen.
Thank you.
Everybody have a good day.
Bye.
You too.